Lower leg strength, particularly calf muscle function, becomes increasingly important after age 50 for maintaining balance, preventing falls, and supporting circulation. Today we're covering the practice of daily calf raises and 6 evidence-based benefits this simple exercise provides: everyday functional strength, ankle mobility, blood sugar regulation support, balance and fall prevention, muscle mass maintenance, and circulatory function. Calf raises target gastrocnemius and soleus muscles through controlled heel elevation movements that can be performed safely at home. When practiced correctly and consistently, they can help maintain lower leg strength, improve ankle function, and support overall health. Before we begin, this is educational content, not medical advice. Always consult your healthcare provider before starting new exercises, especially if you have ankle or knee problems, recent lower extremity surgery, diabetic neuropathy, or cardiovascular conditions. Understanding lower leg strength importance after 50 walking provides cardiovascular benefits but may provide insufficient mechanical load to maintain or build calf muscle strength after age 50. Research indicates adults lose approximately 1 to 2% of lower body muscle mass annually after age 50, with particular decline in calf muscles affecting balance and functional mobility. Calf muscles, specifically gastrocnemius and soleus, are essential for standing endurance and postural stability, ankle joint function and mobility, push-off power during walking and stair climbing, balance recovery when stability is challenged, and venous return supporting circulation. Walking alone, while beneficial for cardiovascular health, typically doesn't provide sufficient resistance to prevent age-related calf muscle decline. Targeted calf strengthening through exercises like calf raises addresses this gap. Benefit 1. Improved everyday functional strength. Calf muscles provide essential strength for daily activities including prolonged standing, walking distances, stair climbing, and rising from seated positions. After age 50, reduced calf strength manifests as increased fatigue during standing, difficulty with stairs and inclines, reduced walking endurance, and decreased confidence in mobility. Regular calf raises directly address this functional decline. Research published in Journal of Strength and Conditioning Research found older adults performing calf raises 3 times weekly demonstrated significant improvements in standing endurance and stair climbing ability over 6 weeks. The exercise rebuilds strength in muscles essential for daily functional activities. Improved calf strength translates to reduced fatigue during standing activities, better endurance for walking and daily tasks, increased confidence in mobility, and enhanced overall functional capacity supporting independence. Benefit 2. Enhanced ankle mobility and flexibility. Ankle joint mobility naturally decreases with aging, affecting balance and movement quality. Reduced ankle flexibility makes challenging activities like squatting or kneeling, walking on inclines or uneven surfaces, stepping off curbs safely, and quick directional changes during walking. Calf raises performed through full range of motion provide both strengthening and mobility benefits for ankle joint. Research from University of Queensland found daily calf raises for 4 weeks increased ankle range of motion by 15% while reducing stiffness and improving balance on uneven surfaces. The controlled movement pattern stretches and strengthens entire ankle complex including muscles, tendons, and joint structures. Improved ankle mobility supports better movement quality and confidence, reduced stiffness affecting daily activities, enhanced balance on varied surfaces, and maintained functional mobility for daily living. Benefit 3. Blood sugar regulation supports skeletal muscle contraction, including calf muscle activation, supports glucose uptake from bloodstream independent of insulin. This metabolic effect becomes increasingly relevant after age 50 when insulin resistance and type 2 diabetes risk increase significantly. When calf muscles contract during exercise, they utilize glucose for energy, potentially helping regulate blood sugar levels. Research published in Diabetes Care demonstrated that brief calf raises performed after meals significantly reduced post-meal blood sugar elevation compared to remaining seated. The muscle contraction stimulates glucose uptake helping manage blood sugar levels. For individuals with prediabetes or type 2 diabetes, incorporating brief calf raise sessions after meals may provide modest supportive benefit for blood sugar management as part of comprehensive diabetes management plan. However, this should complement, not replace, prescribe diabetes management strategies including medication, dietary management, and medical monitoring. Benefit 4. Balance improvement and fall prevention. Falls represent major health risk for older adults, with lower leg weakness contributing significantly to fall risk. After age 50, reduced calf and ankle strength affects ability to recover balance when stability is challenged, confidence during movement, and overall fall risk. Calf raises strengthen muscles and improve neuromuscular control essential for balance recovery. Research in gait and posture found older adults performing daily calf raises demonstrated 40% lower fall risk after 8 weeks compared to control group. The exercise improves ankle strength and stability, neuromuscular control for balance recovery, confidence in movement reducing fear of falling, and proprioception, body position awareness. Enhanced balance and reduced fall risk support continued independent mobility and reduce risk of fall-related injuries including fractures. Benefit 5. Muscle mass maintenance. Combating sarcopenia. Sarcopenia, age-related muscle loss, particularly affects lower body muscles including calves. By age 60, many adults have lost significant lower leg muscle mass affecting functional capacity and independence. Without targeted resistance exercise, this muscle loss continues progressively. Regular calf raises provide resistance stimulus necessary to maintain or potentially increase calf muscle mass. Research in Journal of Gerontology found older adults performing calf raises 5 days weekly maintained or slightly increased calf muscle mass over 12 weeks, while control group experienced continued muscle loss. Maintained muscle mass supports continued functional strength and mobility, independence in daily activities, metabolic health, muscle tissue supports healthy metabolism, and overall physical resilience. Muscle responds to resistance training at any age, making calf raises valuable tool for combating sarcopenia. Benefit 6. Circulatory function and venous return. Calf muscles function as peripheral heart, or muscle pump, assisting venous blood return from lower extremities back to heart. When calf muscles contract, they compress veins facilitating upward blood flow against gravity. After age 50, venous insufficiency becomes more common, manifesting as lower leg swelling and fluid retention, feelings of heaviness or fatigue in legs, cold feet from reduced circulation, and visible varicose veins in some individuals. Regular calf muscle contraction through calf raises supports venous return function. Research in international angiology found performing calf raises twice daily for 6 weeks reduced lower leg swelling by 30% and improved venous return to heart. Improved circulation supports reduced lower leg swelling and discomfort, better oxygen delivery throughout body including brain, potentially clearer thinking from improved cerebral circulation, and reduced cardiovascular strain. This circulatory benefit extends beyond legs affecting whole body health including brain function. Performing calf raises safely and effectively. Here's how to perform calf raises with proper form and safety. Basic version for beginners or those with balance concerns. Stand tall with feet hip-width apart. Hold on to back of sturdy chair or countertop for balance support. Slowly raise heels off ground lifting as high as comfortably possible. Pause and hold at top for 2 to 3 seconds. Slowly lower heels back down with control. That completes 1 repetition. Perform 10 to 15 repetitions. Rest 30 to 60 seconds. Complete 2 to 3 sets. Practice once or twice daily, ideally barefoot or in supportive shoes. Essential technique reminders: rise slowly with control, avoid bouncing. Maintain balance using support as needed. Achieve full comfortable height on toes. Hold briefly at top engaging calf muscles. Lower with control, don't drop rapidly. Breathe naturally throughout movement. Advanced version for progression, same movement pattern as basic version. Hold at top position for 5 to 7 seconds instead of 2 to 3. This longer hold increases time under tension building greater endurance and strength. Progress to this version only when comfortable with basic version. Further progression includes single-leg calf raises, performing exercise on one leg at time, adding light resistance through weighted vest if appropriate and cleared by healthcare provider, or increasing daily sets while maintaining proper form. However, most older adults achieve excellent benefits from basic bilateral version. Safety considerations and precautions. While calf raises are generally safe, certain conditions require medical clearance. Do not perform calf raises without consulting healthcare provider if you have recent ankle, knee, or hip surgery. Timing and appropriateness depends on recovery stage, severe balance disorders requiring assistance for standing, diabetic neuropathy with significant sensation loss in feet, uncontrolled cardiovascular conditions, acute lower extremity injuries, or severe osteoporosis with fracture risk. Even for healthy older adults, start conservatively using support and progress gradually. Stop if experiencing sharp pain, significant joint discomfort, dizziness, or excessive muscle cramping. Mild muscle fatigue is normal, pain is not. Realistic expectations and timeline. Benefits from regular calf raises develop progressively over weeks to months. Weeks 1 to 2, learning proper form and movement pattern, beginning to feel targeted muscles working, establishing daily habit. Weeks 2 to 4, improved exercise capacity, beginning functional improvements, reduced calf fatigue during daily activities. Weeks 4 to 8, clearer functional benefits, noticeable strength improvements, better balance and confidence, possible circulation improvements including reduced swelling. Weeks 8 to 12 and beyond, maintained and progressive improvements, established sustainable habit, clear functional benefits supporting daily activities, continued muscle maintenance combating sarcopenia. However, stopping exercise leads to gradual strength decline, emphasizing importance of maintaining consistent practice. Integration into daily routine. Calf raises integrate easily into daily routine. Ideal timing includes while brushing teeth, 2 to 3 minutes provides perfect duration, after meals, particularly beneficial for blood sugar management support, during commercial breaks while watching television, while waiting for coffee or tea to brew, or as part of morning or evening routine. Consistency matters more than perfect timing. Choose times that work reliably for your schedule, enabling sustainable daily practice. Complementary practices for lower leg health. Calf raises work best combined with regular walking, maintaining cardiovascular health and overall fitness, ankle mobility exercises, circles, flexion/extension, adequate protein intake supporting muscle maintenance, proper footwear providing support without restricting movement, staying well hydrated supporting muscle function, and addressing any foot problems affecting function, bunions, plantar fasciitis, etc. Comprehensive approach addresses multiple factors affecting lower leg health and function. Monitoring progress. Track both exercise performance and functional improvements. Exercise metrics: increased repetitions performed comfortably, longer hold duration at top position, reduced support needed for balance, ability to progress to single leg version. Functional improvements: reduced leg fatigue during standing or walking, easier stair climbing, better balance and confidence, reduced lower leg swelling for those experiencing it, and improved overall mobility confidence. These functional markers indicate meaningful improvements supporting independence and quality of life. Conclusion: daily calf raises provide multiple evidence-based benefits for adults over 50, including improved functional leg strength, enhanced ankle mobility, supportive benefit for blood sugar regulation, better balance and fall prevention, muscle mass maintenance combating sarcopenia, and improved circulatory function supporting whole body health. This simple exercise requires no equipment, takes only few minutes daily, and can be performed safely at home with appropriate support. Start with basic version using chair support. Perform 10 to 15 repetitions, 2 to 3 sets. Practice once or twice daily consistently. Progress gradually to longer holds or advanced variations when appropriate. Use proper form and safety precautions always. Combined with regular walking, healthy nutrition, and comprehensive fitness approach, daily calf raises support continued lower leg strength, mobility, and independence after age 50. Thank you for watching. For specific concerns about appropriate exercises for your situation, consult healthcare provider or physical therapist for personalized assessment and guidance. Subscribe for evidence-based information on functional fitness and strength training for older adults, practical guidance prioritizing safety while helping you maintain strength and independence through simple effective exercises.